Eye infections can have various causes, including viruses, bacteria, fungi, or parasites. The symptoms of an eye infection can vary depending on the underlying cause and the affected part of the eye. Common eye infection symptoms may include redness. The whites of the eye, sclera, may appear pink or red, which is a common sign of inflammation or infection. Eye discharge. Depending on the type of infection, you may notice discharge from the eye. This discharge can be watery, thick, yellow, green, or even bloody. Conjunctivitis. Pink eye. This infection typically causes redness, itching, tearing, and discharge. Pain or discomfort. Eye infections can be painful, causing a sensation of discomfort or even a throbbing pain. Tearing. Excessive tearing or watery eyes can be a response to irritation and inflammation caused by the infection. Itching. An itchy sensation in or around the eye is a common symptom, especially in cases of allergic or viral conjunctivitis. Burning or stinging. The eye may feel like it's burning or stinging, which is often associated with discomfort. Sensitivity to light, photophobia. Some eye infections, such as viral or bacterial keratitis, can make the eyes more sensitive to light. Blurry vision. In some cases, an eye infection can cause blurred or decreased vision. Foreign body sensation. It may feel like there's something in the eye, causing irritation or discomfort. Swelling. Swelling of the eyelids, especially if accompanied by redness, can be a sign of an eye infection. Crusting of eyelids. In the morning, you may notice crusts or flakes on the eyelids or lashes, particularly in cases of bacterial conjunctivitis. Eyelid twitching or spasms. In some cases, eye infections can lead to involuntary eyelid twitching. Change in eye color. In rare cases, an infection can cause a change in the color of the iris, particularly if the infection affects the anterior chamber of the eye. It's important to note that the specific symptoms can vary depending on the type of eye infection. For example, stye. A stye is a painful bump or lump on the eyelid and may be accompanied by swelling and redness. Keratitis. This infection affects the cornea and can lead to severe pain, light sensitivity, and blurred vision. Blepharitis. An infection of the eyelid margins can cause redness, itching, and crusting of the eyelids. Most asked questions about eye infection symptoms. What are the common causes of eye infections? Eye infections can be caused by various factors, including viruses, bacteria, fungi, parasites, or irritants like allergens or foreign bodies. Are all eye infections accompanied by redness and discharge? No, not all eye infections present with redness and discharge. The symptoms can vary depending on the type of infection and its severity. Can eye infections cause vision loss? In some cases, particularly if left untreated, eye infections can lead to vision problems or even vision loss. Prompt medical attention is crucial to prevent complications. Are eye infections contagious? Many eye infections are contagious, particularly viral and bacterial conjunctivitis. It's essential to practice good hygiene, avoid touching your eyes, and wash your hands to prevent the spread of infection. Can eye infections be treated at home with over-the-counter remedies? Mild cases of eye infections may improve with over-the-counter artificial tears or warm compresses, but it's essential to consult a healthcare provider for a proper diagnosis and treatment plan. In some cases, prescription medications may be necessary. What should I do if I suspect I have an eye infection? If you suspect you have an eye infection or are experiencing symptoms like redness, discharge, pain, or changes in vision, it's advisable to seek medical attention promptly. Avoid touching or rubbing your eyes to prevent further irritation. Is it safe to wear contact lenses during an eye infection? It is generally not recommended to wear contact lenses while you have an eye infection. Contact lenses can trap bacteria or irritants against the eye, exacerbating the infection. Consult with your eye care professional for guidance. Can allergies mimic the symptoms of an eye infection? Yes, allergies can cause symptoms similar to those of eye infections, including redness, itching, tearing, and swelling. Allergic conjunctivitis is a common condition that can be mistaken for an eye infection. Are children more susceptible to eye infections than adults? Children can be more susceptible to certain types of eye infections due to their close contact with other children in school or daycare. Conjunctivitis, often called pink eye, is a common childhood eye infection. How can I prevent eye infections? To reduce the risk of eye infections, practice good eye hygiene, avoid touching your eyes with unwashed hands, and protect your eyes from irritants, such as dust or chemicals. If you have allergies, manage them effectively, and avoid allergens that trigger eye symptoms. If you suspect you have an eye infection or are experiencing any of these symptoms, it's essential to seek medical attention from an eye care specialist or a healthcare provider. Eye infections can vary in severity, and prompt treatment is crucial to prevent complications and to ensure a proper diagnosis and treatment plan.